So today we are going to see about beta-lactam antibiotics. So what do you mean by this beta-lactam? So these are the compounds having beta-lactam ring in their structure. So the beta-lactam antibiotics are penicillin, cephalosporins, carbapenems, monobactam. All these are having beta-lactam ring on their structure, so they are called beta-lactam antibiotics. Understand? So what are the beta-lactam antibiotics? The compounds having beta-lactam ring in their structure is known as beta-lactam antibiotics. The compounds are penicillins, cephalosporins, carbapenems and monobactam. In this we are going to see about today this penicillins. So this is the first antibiotic invented by the Alexander Fleming. So in his factory he saw a bacteria. When he is culturing this bacteria, he saw a fungus which is present in the bacterial stain is destroying the bacteria. So he thought this fungus is having antibacterial activity, so he named this as a penicillin. So initially we prepared penicillin from Penicillium notatum. Now we are preparing penicillin from Penicillium chrysogenum because Penicillium notatum is having less yield compared to Penicillium chrysogenum. It is the first antibiotics used clinically. So see, this is the beta-lactam ring. So these compounds which are having this beta-lactam ring is known as beta-lactam antibiotics. So this beta-lactamase, this is the enzyme produced by certain microorganism. This is otherwise known as penicillinase, will destroy this penicillin by opening this beta-lactam ring and inactivate the penicillins. Okay, so now we see the classification of penicillin. We can classify the penicillins into natural penicillins, that is obtained from Penicillium chrysogenum, penicillin G, this is otherwise known as benzyl penicillin. Then semi-synthetic penicillins, in that we are having acid-resistant penicillin. This is phenoxyethyl penicillin, because penicillin if we are giving by oral route, it is destroyed by the gastric acid present in the stomach. So we can't give this natural penicillin by oral route. In order to overcome this, we are preparing the converting the natural penicillin into a acid-resistant penicillin, that is phenoxyethyl penicillin and phenoxymethyl penicillin. Then beta-lactamase or penicillinase is the enzyme produced by certain bacteria, especially Staphylococcus species, so that destroy this beta-lactam ring and open the ring and convert it into an inactive compound. So we are having beta-lactamase resistant penicillin, that is methicillin, cloxacillin, dicloxacillin, nafcillin, all these are penicillinase resistant penicillin. Then this penicillin is a narrow spectrum antibiotic. It is effective only for gram-positive bacteria. So we are extending the spectrum to the other organism. That's why the other is coming extended spectrum penicillins. In this we are having aminopenicillins, that is ampicillin, amoxicillin, carboxypenicillin, carpenicillin, iridopenicillin, piperacillin, mesoxicillin. So when penicillin is having very short duration of actions, so we are combining penicillin with other substance to produce repository preparations, that is procaine penicillin, benzapine penicillin. Procaine penicillin is having duration of action 24 hours and benzapine penicillin is having duration of action around 7 to 1 month. And anti-pseudomonal penicillins, that is carboxypenicillins and iridopenicillins, they are effective for pseudomonas infections. Anti-staphylococcal penicillins, that is beta-lactamase resistant penicillin, because this staphylococci produce an enzyme called beta-lactamase or penicillinase. So now we will see the detail about this penicillin G. Mechanism of action of penicillin G is that is it, if you want to tell it in one word, you can tell it as that is it inhibits the cell wall synthesis of the bacteria. So this gram positive bacteria is having cell wall. It is made up of peptidoglycans and N-acetyl muraminic acid. So there is a cross linking between these peptidoglycans and N-acetyl muraminic acid. This is catalyzed by the enzyme penicillin binding protein or transpeptidases. Understand? So this penicillin binding protein is necessary for this linking of these two chains. Penicillin bind with these enzymes, that is penicillin binding protein, and inactivate it into an inactive compound. So that will lead to cross it inhibit the bacterial cell wall synthesis, thereby bacterial cell swells up and rupture. Hence, beta-lactam antibiotics are bactericidal antibiotics. Understand? So, if the cross-linking takes place, it provides rigidity to the cell wall. Penicillinase inhibit the penicillin binding protein. Penicillins inhibit the penicillin binding protein, hence cross-linking will not take place and a cell wall deficient form are produced. So spectrum of penicillins, if you see the spectrum of activity, penicillins are narrow spectrum compound. What do you mean by narrow spectrum? They are effective either gram positive or gram negative organism. So here this penicillin is effective for gram positive organism such as streptococci, bacillus, anthracis, Corynebacterium, diphtheria, anaerobes like Clostridium tetani, Listeria, then Trypania pallidum, pneumococcal pneumonia, meningococcal meningitis, and actinomyces, leptospirosis, all these will respond to this penicillins. If we see this pharmacokinetics, penicillin G is destroyed by gastric acid. So normally it is given by intravenous or intramuscular injection. It reaches the brain during meningitis. It is a non-teratogenic drug, so it is safe in pregnancy. It is excreted unchanged through the urine by tubular secretion. So what do you mean by this tubular secretions? So in the glomerular filtrate, the penicillin is not present, but it is coming in between the process, that is it is secreted in the tubules. Its secretions can be prevented by adding propenicid. So propenicid will get excreted and increase the duration of action of penicillin. It prevents the excretion of penicillins. Okay, so hence propenicid is used in penicillins, especially in conditions with subacute bacterial endocarditis and gonorrhea. And if you see the penicillins, repository preparations, benzene penicillin is converted into procaine penicillin, and it is the most commonly occurring allergic. This procaine penicillin is considered to be allergic to many people. It may produce mild allergy to anaphylactic shock. So you have to do a allergic test before giving this penicillins. You have to ask the history. If the penicillin is allergy, don't put penicillins to these people. Okay, then benzathine penicillin, it is having long acting actions and it is having long duration of actions. So adverse reaction of the penicillin is hypersensitivity reaction. So it is these penicillin is having least adverse reaction. It is the one of the best antibiotic having less adverse reactions. Okay, so the main adverse reaction for penicillin is hypersensitivity reaction. It will produce mild skin rash like itching, severe form can be anaphylactic shock. So what do you mean by anaphylactic shock? Anaphylactic shock means it is the acute form of allergy. So the symptoms are hypotension, bronchospasm, laryngeal edema, pathogenesis. For this anaphylactic shock is immunoglobulin G mediated type 1 hypersensitivity reaction. So the treatment for anaphylactic shock is adrenaline 0.3 to 0.5 ml 1:1000 solution intramuscularly, injection hydrocortisone 200 mg intravenously, injection diphenhydramine 50 to 100 mg intramuscularly or intravenously. Precautions to avoid hypersensitivity reactions: penicillin, proper history taking, ask for any previous history of allergic manifestation. Sensitivity test should be done by giving drug dermally. And other adverse reactions of penicillins are pain, abscess at the site of injections, thrombophlebitis, resistant, and Jarvis-Hexkemer reaction. What is this Jarvis-Hexkemer reaction? So it is the reaction when we are giving penicillin to a syphilis patient. There will be exacerbations of the symptoms of syphilis during penicillin therapy due to release of toxins from the dead organism. The symptoms will be fever, high fever, myalgia. So we can treat these symptoms by giving aspirin or steroids. So if you see the advantages of penicillin, disadvantage of penicillin G, it is having bactericidal activity and it is very cheap. It is safe in pregnancy because it is not a teratogenic drug. Okay, less chance of superinfection. But a disadvantage, it is destroyed by gastric acid, so we can't give this drug by oral route. It is having narrow spectrum of activity. It is effective only for gram-positive bacteria and it is having very short duration. The duration of action is 4 to 6 hours and it is destroyed by beta-lactamase. So in order to avoid these things, we are preparing the semi-synthetic penicillins. Now we will see the uses of penicillin G. So penicillin G is used in dental purpose, medical purpose and prophylactically also it is used in many conditions. So for the oral infections, penicillin B is commonly used. Peripheral apical abscess. So what do you mean by this peripheral apical abscess? Abscess formation, periodontal abscess, ulcerative gingivitis, extraction of infections, salivary gland infections. So in these conditions, we can use this penicillin treatment. Then other medical uses is it is the drug of choice for the pneumococcal infections like pneumonia and meningitis. Then streptococcal pyogens infections like pharyngitis, otitis media, sinusitis, pneumonia, endocarditis, septicemia, etc. Meningococcal infections like meningitis, it is the drug of choice, and syphilis, Brocaine or benzathine penicillin is the drug of choice. Other uses of penicillin is that is other infections like actinomycosis, leptospirosis, lisariasis, diphtheria, tetanus, gas gangrene can be treated with the help of penicillin. Then prophylactic uses for penicillin is in rheumatic fever, benzathine penicillin is the drug of choice. To prevent the bacterial endocarditis in valvular heart disease patient can be the penicillin G is used. Now we are going to another section, semi-synthetic penicillins. In order to overcome the disadvantages of penicillin G, we are preparing this semi-synthetic penicillin. So this acid-resistant penicillin, that is phenoxyethyl penicillin, it is otherwise known as penicillin V. Then penicillinase is the enzyme produced by certain bacteria, staphylococcal bacteria. So we are having penicillinase resistant penicillin, methicillin, cloxacillin. Then extended spectrum penicillins. Penicillins are normally narrow spectrum of activity. So we are extending the spectrum of activity. In this we are having aminopenicillins like ampicillin, amoxicillin, iridopenicillin, piperacillin, azoxicillin, mesoxicillin, carboxypenicillin, carpenicillin, tricarcillin. So this is the semi-synthetic penicillins. So in this we are having extended spectrum penicillins, or in this aminopenicillins. So before that we are having this phenoxyethyl penicillin and phenoxymethyl penicillin. Penicillin B, it can be given by oral route for certain infections like this meningococcal meningitis can be treated with the help of penicillin B. This drug can be taken oral route. Then penicillinase resistant penicillins, this carboxypenicillin, cloxacillin, they will bind with the penicillin binding protein and inactivate this beta-lactamase enzymes. So it cannot be given. If you are giving alone, it will not produce any action. So we have to give along with other drug in staphylococcal infections. Okay, so then extended spectrum penicillins, we are going to see about ampicillin, amoxicillin. This is ampicillin is orally effective. It is also destroyed by the enzyme penicillinase. It is given by oral, intramuscular or intravenous route. So if you see the mechanism, same mechanism like penicillin G, it inhibits the cell wall synthesis of the bacteria. It inhibits the cross-linking of peptidoglycans by binding with the penicillin binding proteins. So it weakens the bacterial cell membrane and death of the bacteria. It is also a bactericidal. If you see this spectrum of activity, it is same as penicillin G. That is, what is the spectrum of activity for penicillin G? It is effective against gram-positive bacteria like Streptococcus pyogenes, Staphylococcus pneumonia, Bacillus anthracis, Corynebacterium diphtheriae, anaerobes like Clostridium tetani, Listeria, N. gonorrhea, meningitis, and other actinomyces, Treponema pallidum, etc. So it is also, this ampicillin is also having same therapeutic uses like this one. Besides this, it is also effective for some gram-negative bacteria such as E. coli, Shigella, Salmonella, H. influenza, H. pylori, etc. Okay. So adverse reactions of aminopenicillins, it is mainly hypersensitivity reaction. If penicillin is allergy, amoxicillin, ampicillin, everything will be allergy. So diarrhea most common with this ampicillin, because ampicillin is a coarse powder. It will adhere to the intestinal wall and increases the peristaltic movement. So it causes diarrhea. Diarrhea is the common adverse reaction. Other adverse reaction is superinfections. So superinfections means it is destroying both the gram-positive and gram-negative organism, which favor the growth of fungal infections. So it produces superinfection. Understand? So the next one is, we can compare and contrast this ampicillin, amoxicillin. Ampicillin is a semi-synthetic penicillin. This amoxicillin is also same thing, and they are extended spectrum. That is, they are effective for gram-negative bacteria also. Amoxicillin is also same thing. Mechanism of action, they inhibit the cell wall synthesis of the bacteria. Here also they are inhibit the cell wall synthesis. Both are acid stable, incomplete, but ampicillin, there is one, it incompletely absorbed from the GAT. Since it is a coarse powder, it is not completely absorbed from the GAT. It is incompletely absorbed from the GAT. So diarrhea is very common with the ampicillin. But the amoxicillin is a fine powder. It is completely absorbed from the GAT, so less diarrhea. Food decreases the absorption, but food will not interfere with the absorption of amoxicillin. More effective in a Shigella, H. influenza organism, but amoxicillin is less effective for these dogs. Have to be given 4 times daily. It is given 3 times daily because it is having long duration of actions than ampicillin. So if you see the uses of aminopenicillin, dental infections, orodental infections can be treated with the help of ampicillin and amoxicillin. Respiratory tract infections like sinusitis, pharyngitis, tonsillitis, otitis media. Urinary tract infections by E. coli, typhoid, H. pylori infections, serious infections like meningitis, septicemia. So here additionally we are having this urinary tract infection caused by E. coli. E. coli is a gram-negative organism. Again typhoid. Typhoid is caused by Salmonella typhi. It is a gram-negative organism. H. pylori, it is the organism which is producing this peptic ulcer. So Helicobacter pylori. In that regimen also we are having this amoxicillin. Serious infections like meningitis. Septicemia means resistant bacteria in the blood is known as septicemia. Then finally we are going to see about this beta-lactamase inhibitors. The beta-lactamase inhibitors are clavulanic acid, sulbactam, tazobactam. The beta-lactamase is the enzyme produced by bacteria which degrade the beta-lactam ring and inactivate the beta-lactam antibiotics. Beta-lactamase inhibitors will competitively bind to beta-lactamases enzymes and inactivate them. So thus co-administration of these drugs with the beta-lactam antibiotics can increase the activity of beta-lactam antibiotics by preventing them from enzymatic degradation. So this beta-lactamase inhibitors like amoxicillin, clavulanic acid combinations can be given for skin infections, soft tissue infections, respiratory tract infection, urinary tract infections. So that will respond very nicely. Then piperacillin tazobactam intravenously in severe infections like septicemia and pneumonia. So if we see the main points again, the penicillin is a narrow spectral antibiotic produced by Penicillium notatum, and if we say this, it is effective for gram-positive bacteria. So what do you mean by beta-lactam antibiotics? Penicillins, cephalosporins, carbapenems and monobactam. All these drugs are cell wall synthesis inhibitors. So this is, then we have seen the classification and mechanism of action. Then we have seen the pharmacokinetics and adverse reactions, treatment of adverse reactions. Then we have seen about the advantages and the disadvantages, then therapeutic uses. Then we have seen this semi-synthetic penicillins. So okay, that's all regarding the penicillins.